Okay. Yeah. So I guess I'll just go ahead and get started and hope that people can figure out the new link. And I did update the noperiod.info link, so it should come here. So I guess that's it. So yeah, hi everyone. Sorry for the delay. I am Dr. Nicola Rinaldi, PhD in computational biology from MIT, and I experienced hypothalamic amenorrhea myself, 12, 13, 14 years ago now. It was a long time. But it's really become my passion to help women understand what's going on with their bodies, why they're missing their periods, and just to help them recover, get pregnant. So I wrote my book, No Period, Now What? And a friend of mine told me I should get a poster and put it up on the wall. So I have that now too. And so I also quit my day job, and now I work doing this full time, managing my Facebook support group, which you can get to at noperiod.info/support. And working with women one-on-one and sharing the message online and going to conferences, and it's just a lot of fun. So anyway, I will get stuck into the questions now. If you have any other questions that come up as I'm going through this, feel free to ask them in the chat window. I will try and manage everything all at once and see how I can do with that. Okay, so I like to divide the questions that I get asked into categories, and kind of so that we kind of talk about the same kinds of things, kind of at the same time. So we're just going to get started with diagnosis. So there are a few questions on how do you diagnose HA, one just very generally. So I will say that this is all discussed in the book. It's chapter 4 is on diagnosis. The first section is basically HA, what it is, how, the factors that can cause it, why it's important to recover in terms of bone density and all of that. Diagnosis, PCOS versus HA, all that stuff, first section of the book. But so just some questions on how to confirm HA. How would you know if from a woman who's on the older side, she says 46 and no period for years due to over-exercise and underfueling. How would you know if it's HA or menopause? So really the best thing to do is to go and see your doctor, your physician, medical doctor, general practitioner, whatever, and get some blood work done. That's probably the best way to really diagnose HA. So in terms of what you might expect, you would expect to probably see a low level of luteinizing hormone, not necessarily below the normal range. The normal range is typically 2 to 20 or something like that. Women with HA will tend to have low LH values, so less than 2 or maybe 2, 3, 4, but not typically something that's quote unquote normal, which is really the 6, 7, 8 plus range. So that's probably the best marker for HA. If you have menopause, your FSH and LH will be sky high, your estradiol will be low. So that's a big difference from HA. And HA, not only is your LH often suppressed, FSH can be as well, and that sort of depends on the severity of the HA. So if you have an FSH that's low, like 2, 3, 4, that sort of tells you that your system is a little bit more suppressed, because FSH is not typically regulated by the hypothalamus, but it can be lower in some women. And working to have doctors recognize HA, particularly at normal BMIs. I do have an information sheet that's available on my website. If you go to noperiod.info/HA, you can download the first chapter of my book and the HA information sheet. That can be really useful to give to doctors, because it kind of shows the distribution of BMIs of women that have experienced HA. It sort of shows the distribution of exercise, caloric restriction, weight loss that's commonly seen prior to somebody getting HA. So that can be a useful piece of information to share, and actually have that available in a number of other languages besides English as well, and working on some more. So I will be posting those soon. So that's one thing. I think that's really the best way to get doctors to recognize that HA can occur in somebody of any size body, which I know to be true. Doctors will often look at somebody and be like, oh, you can't have HA because you're not thin enough, and I'm not really sure where that comes from, but really HA comes from underfueling for your body size, often coupled with high intensity exercise, often coupled with either chronic or acute stress. So that's sort of where it comes from. Diagnosis, again, it's kind of based on blood work. It's based on sort of looking at those lifestyle factors. You have to take that into account when you're kind of figuring out if somebody has HA. It also means sort of checking on other possible causes of amenorrhea. So one of them, for example, is hyperlactin. So that's something that should be checked. PCOS is another cause of amenorrhea. Typically, you will see high androgens, which is testosterone, androstenedione, DHEAS. Congenital adrenal hyperplasia is another possible cause of amenorrhea. There you would see very high 17-hydroxyprogesterone. So it's really about ruling out some of those other conditions that can cause missing periods. Asherman syndrome is another one. That would be scarring in the uterus that can prevent bleeding. In that case, you would still be ovulating and getting signs and symptoms of ovulation, but not actually getting a bleed. All of those are pretty, well, except for PCOS. PCOS is actually more common than HA, so many women with HA are misdiagnosed with PCOS. But the others are really very rare, so it's quite unlikely that if you're somebody who's been exercising a lot, maybe restricting either calories or food groups, or maybe you have just been unintentionally under eating, and that's something we can talk about in a little bit. So I hope that's helpful for the people that have those questions. Okay, so let's move on a little bit, just to general conversation about HA. Couple things. I think we already kind of talked about plants and somebody asked, said, I'm not underweight, can I still have HA? Having lost a lot of weight in the past, weight loss is absolutely a risk factor for HA because it basically means that you've been underfueling your body for a while. And so that's when I did the analysis for my book, I did a survey of over 300 women to kind of figure out what factors were involved in their getting HA. And I was actually quite surprised at the answers to the weight loss question that 82% of the women in the survey had lost 10 pounds or more in the past. That's about 5 kilograms. I wasn't expecting anything like 82%. So definitely having lost a lot of weight can lead to HA. Again, no matter what your absolute body size is, HA does not care whether you're teeny tiny or whatever your size body you're in. It's just about, have you been underfueling for your body? And your body has kind of a set point range that it likes to be at. And so just being under that range or underfueling to get yourself under that range, that can be enough to cause HA or a missing period, basically. Does LH level correlate with HA severity and how long it takes to recover? I would say it correlates with HA severity. I'm not sure that it necessarily correlates with time to recover. That's a good question, though, and I do have data that I can look at, so I will do that and do a blog post on that because I think that's a really interesting question. Trisha asked, can family history of endometriosis be related to HA or PCOS? That's not something that I know about. I haven't looked into it, but I wouldn't suspect there would be a correlation because, again, HA is more about underfueling, perhaps a lot of exercise, perhaps stress. And I'm not really sure that would be related to endometriosis, which is sort of when the uterine lining or cells from the uterine lining are growing in inappropriate places in your abdominal cavity, like outside your uterus and around your ovaries. So I don't think those two are related. Phyllis asked, can hepatic adenomas be caused by HA? They're usually caused by the pill. I actually have no idea, so that's a question I would have to go and research. That's not something that I know off the top of my head, so I'm going to pass on that one. Missy asks, do anovulatory cycles give you the same level of protection against osteoporosis as ovulatory cycles? That's a great question, and I think the answer is for sure no, they do not, because in an anovulatory cycle, you don't have a follicle that's growing and the estradiol level is increasing as the follicle grows. I suppose you could have an ovulatory cycle because you have a follicle that grows, but then just doesn't, the estradiol level doesn't get high enough to trigger the LH surge, which causes ovulation. So I suppose maybe, but I would typically say no, because you don't have a follicle that's grown big enough to actually ovulate, and then you get a bleed because the estradiol level drops. But I think the estradiol probably isn't being sustained as high as it is in an ovulatory cycle. That would be my suspicion. Kate asks for help with conversations with GPs. Kate, if you're watching, if you could elaborate on that question in the chat window a little bit, tell me a little bit more about what you're looking for, that would be great. I think, again, just sharing some of the information sheets that I have available on my website. It's noperiod.info/HA or noperiod.info/HAVS-PCOS for the information sheet on HA is compared to polycystic ovarian syndrome. So Koryach asks, at what point should you go to the doctor if your cycle is irregular or missed? I think typically they say when coming off the birth control pill, your period should come back within about 3 months. I think it's probably worth checking in with your doctor after more than one missed cycle. You can have one missed cycle for a variety of reasons. If you have a lot of stress, for example, and once the stress is relieved, then your cycle will come back. If it's longer term than that, then I think it is worth looking into. You have to keep in mind, though, that as we discussed earlier, not all doctors are aware that women of any body size can be missing periods through HA. So, it's good to go to rule out any acute conditions, any, like a microadenoma on your pituitary that can cause elevated prolactin levels. But typically, if you'll have the lifestyle factors. If it is HA, you'll probably be exercising a lot. You'll probably have some stress around tracking calories and macros. That's so. I think after when you're getting to the second missed cycle is the time that I would probably suggest going to see a doctor and sort of thinking about what might be going on here. I'm just going to see if there are any chat questions yet. Okay. So Annalie is asking, how often should I need to get some blood work after diagnosis? So that's an interesting question. I think it really depends on what you would be using the blood work for. So I've seen women get blood work done about every 6 weeks, and that's typically enough to see some kind of change. But I often ask, well, what are you going to do differently depending on what the blood work says? And I think that's, just something to think about. Is it, some women find it helpful to get blood work done, but depending on the results, if you haven't seen changes, what are you going to do then? If there are changes, what are you going to do? Is it going to make a difference to what you're actually doing? So there's not a huge amount of value in getting blood work done because it typically doesn't change what your path, unless you feel like you need kind of validation that what you're doing is helping, in which case that can be useful. But again, if things haven't changed that much, or if they don't change in a way that you expect, then it can be a little bit more challenging as well. So I would just kind of know yourself and think about how that's going to affect you personally in terms of if it's going to be helpful or harmful potentially. Because I have to say that the recovery plan that I'm going to describe of eating more and exercising less, it works. I mean, it's been 12 years that I've been working with people now, and countless women have recovered by doing this. And everyone thinks they're going to be different. It's not me. I'm going to be the one that ends up, having made all these habit changes, and I'm still not going to get pregnant, or I'm still not going to get my period back. That's a really common feeling. I think it's just fear. You fear that you're going to make all these changes and kind of undo all the hard work that you've done over the years and kind of get nothing from it. But that's just not been my experience. And like I said, I've been working with women for 12 years now, probably over 1,000 babies at this point. So, it definitely works. Yasmin, I think that's probably a question that you and I should just talk about separately. I think that's, yeah. So let me get to my other question list for a second. Okay, so, okay, CVAC asks, is it advisable to work night shifts with HA? This is a tough one. I mean, I know there are women that have recovered from HA working night shifts. I think it is a little bit more challenging just because you're working against your body's natural rhythms. But I think that if you are continuing to fuel, like if you're working on fueling your body appropriately and you're cutting out high intensity exercise, and you just do what you can to get, as much sleep as you can in the times when you're not working, it's probably okay. I can't say for sure one way or the other. Obviously that's a very personal question. So let's see. Leah asks, I haven't had my period and I'm a bodybuilder. I love my training. I don't know what to do. This is so common. I think so many of us love the exercise that we do. For me, it was ice hockey and volleyball and squash. And I just really enjoyed hanging out with my friends and playing all these games. And, I didn't think of it as exercise really. It was just fun and I loved it. But the problem is that when we're underfueling our bodies, which is very common when you're working as a bodybuilder, because there's a certain physique that you're supposed to maintain, then it becomes problematic for our bodies, and we don't have enough energy to fuel that exercise that we're doing along with everything else that our body does. So you have to remember all the amazing things that your body is doing day in, day out, every second of the day. It's pumping your blood, letting you breathe, giving your brain energy. It's growing your hair and nails. All the individual billions of cells inside you are producing protein and DNA, and all of that takes energy. So when you cut your calories because you want to decrease body fat, then you are not allowing your body to do all of those things that it needs to do. So it has to pick some things to shut down in order to conserve energy, because the exercise you're doing gets done no matter what. Those muscles are moving, they're burning that energy. So it's only what's left over afterwards that our bodies have to work with to support all of those other processes. And so there's another question that's come up a lot, is how does exercise actually affect HA and our bodies, and why is it that exercise plays a part, and why is it that I recommend cutting out high intensity exercise in order to recover? So the answer to that is that exercise often increases cortisol and other stress hormones. And I think that's really the biggest, so there are two components actually. There's the calories that exercise burns, which is what I was just discussing. And then there's also the stress hormones that are created specifically from high intensity exercise, which can be heavy weightlifting, because that can be very, your heart rate can get up quite high. And that's sort of how exercise intensity is measured, as well as just how much work your muscles are doing. So those stress hormones, if you have, if you have your hypothalamus and it's taking in all of these inputs from around your body, and then it's sending out hormonal signals to control everything that it controls. Like, do you feel hungry? Do you feel full? Do you, what types of foods do you feel like eating? It's, it's controlling all of those. It's controlling how warm you feel. So the problem is, even if you've lifted the suppression on your hypothalamus by eating more, the stress hormones can still be suppressing. So I feel, in my experience, you really have to lift the suppression from your hypothalamus in as many ways as possible, which means addressing all three aspects. So eating more, including eating as many food groups as you can, cutting out that high intensity exercise because of the stress hormones that impact and suppress the hypothalamus, and then reducing sort of psychological stress as much as you can as well. So that can be things like meditating, or just listening to a calming app, or the stress reduction part is not my forte. I have to admit, I'm not a psychologist. So going to see a therapist can be really helpful. Often replacing some of the exercise that you used to do with other things that can be more soul nourishing, like hanging out with friends. That can be something that's really helpful. So let's see, I've got a few more questions here. So I think Bruna is asking, is it normal to still take a long time to get your period back when blood work is normal? That is a really common thing that happens, is you work towards recovery, you eat more, you exercise less, you get blood work checked, and it's like, it's gone from, your LH is less than 2 to it's 6, and your FSH is 6, and everything looks great. And that is great, but there's a little bit more to it than that. So there's our baseline hormones, which is what's measured when you just go in for a random blood test. And then there's that signal that starts the follicular growth process. And we don't know exactly what it is. It seems like maybe it's a hormone called kisspeptin, but we don't exactly know how to get that started. Like there's no button you can push and say, okay, I'm ready, let's get those periods started. So that's kind of where the time component comes in. It seems like it's just a matter of time once you've restored your body weight. And I don't mean just to like quote unquote normal. It's restoring to the weight that is normal for your own body. That can be a range of body sizes. In the book, I talk about the fertile zone as being a BMI of 22 to 23 or more. And that's because many women who are in bodies that are smaller than that have been underfueling for a long time. And that does tend to be sort of the minimum fertile zone in terms of getting periods back and getting pregnant. Not to say that it can't happen at a lower BMI than that. It certainly happens at higher. It's such an individual thing. But so assuming that your body is back to a size that it is comfortable at, which typically is around the size that it was before you lost weight. If you had a significant weight loss, it may be a little bit less than that. It may be a little bit more than that. That's something that's incredibly individual. And I can give you a better idea of that if we work together one-on-one. But so assuming your body weight is back to where your body is happy and you're fully nourishing your body on a day-to-day basis, eating throughout the day, eating enough calories, eating as many different food groups as you can, you've reduced your stress. That's like you've set the stage for recovery, but the actors still need to come on. There still needs to be that signal to get things started. And I don't know what it is. So really the only thing you can do is wait. I mean, that's not the only thing you can do. There are medications that you can use to jumpstart that process, which is Clomid and Femara and maybe soy isoflavones. So that's definitely something that you can consider. I wouldn't really think about it until you've been sort of all in like that for 5 to 6 months. And if you're not in a huge rush, then just waiting a little while may be all that you need. So I think that's my response to that question. So let's see, Annie and Tricia are asking about, is it important to track the 2,500 calories? I would say no. I think it can be helpful to start with just to get an idea of what 2,500 calories really looks like for you and how you can incorporate through your day. Because sometimes when we have HA, we often tend to overestimate how much we're eating. I see that really commonly. I know that was something that I did myself. I was like, well, this is my caloric target, and I certainly don't want to go over that. So if I don't know how many calories something has, I'm going to just guess a little bit more than it probably has. And that's something that, lots of us do. And I think it's, it can be a hard mindset to get out of. So it's good to track your calories for a few days just to kind of figure out what that 2,500 looks like for you. But then after that, I just find tracking to be it's more stressful than anything. It takes a lot of mental energy, and it keeps that number forefront in your mind, and you're just kind of thinking about it all day long, which is, that's not helpful, because then you're focusing too much on your food and what you're eating. And really the idea is to get to the point where you're just eating, and once you know what it looks like, you just eat and you enjoy your food and you move on with the rest of your day. Same thing with like step counters and stuff. There's even if you're not really super focused on it, your Fitbit still buzzes when you get to that 10,000 steps, and it's still kind of keeping it in your mind. Same thing with the scale and weighing yourself. That's something I really recommend, is like stopping that practice. There's just nothing good that comes of it. And it's another thing that keeps a number in your head all day, and that can be stressful. And especially if you're used to being at a particular size and now you're getting beyond that size or weight, that can be really mentally challenging, because we've been taught for so long by society that that's not what we're supposed to do. So anyway, okay. So Amy's asking, when you're still in the midst of HA, why do you wake up sometimes with a lot of puffiness around the eyes? Some days it's there and some days it's not. I do not have an answer for that question. I'm sorry. It could, yeah, I really don't know. So I'm going to move on to the next question I have in my list here. Okay. So I think we're on to recovery a little bit. Okay, so there was another question about from someone whose doctors are saying that her ovaries are shriveled and she needs to take progesterone and testosterone and everything. It's really common with HA to have small ovaries and uterus, and once you work on eating more and exercising less and nourishing your body, that is very likely to change. So I would perhaps you would consider going on some kind of hormone replacement therapy for a few months while you're working on recovery, particularly if you're at a quite a low body weight. Also, if you know that you have any kind of bone density issues, then being on some kind of hormonal replacement therapy for a few months while you're working on recovery can be beneficial just for preventing extra bone loss. Yeah, okay, so Jenny asks, I'm curious about the effect of 3 things on HA recovery and which one is or are more key. And then somehow I lost the rest of those questions. So they all had to do with body weight and how that relates to, is it the amount of weight that you gain? Is it getting back to your original body size? And which is more, and does the weight sort of relate to how long it takes to recover? So I would say probably the most important thing is sort of getting back to a size that your body is comfortable at. For some women, that can just be a small amount of weight. For some women, it's a much larger amount of weight. So there's no one size fits all here. There's no like magic BMI that if you get to BMI X, then you will get your period back. It really has a lot to do with our genetics, sort of what our body size naturally wants to be and how long we've suppressed ourselves from that body size. So yeah, I would say that you kind of have to look back through your own history and figure out like where your body might actually be happy. And like I said, if you've been small all your life, if your periods started late, if they've always been irregular, then your weight might have been suppressed for most of your life, and you might need to get to a place that's a little bit bigger than you were then. Or if you had a time where you were cycling very regularly, then that's probably a good place for you to end up. You may need to go a little bit higher than that in order to get your periods restarted. That seems to be, I have a blog post on that. It's noperiod.info/activate. I sort of think of it like a chemical reaction. So often it takes to get a chemical reaction started, you have to input more energy than it takes for the chemical reaction to continue. And I sort of see the hypothalamus in the same way. You might have to gain a little bit more weight. You might have to cut your exercise more than you had in the past when you were cycling normally. And that's just to get your hypothalamus restarted. And then, it's common for things to kind of normalize after you've had your period back for a while, and your body will kind of settle to the weight that it feels most comfortable at, without you having to go on a diet or do anything ridiculous like that. I do have Kristen, I do have a list of questions that I'm working through, so I kind of have them organized by topic. So hopefully I will get to yours in a few minutes. I'm going to try. I'm going a little more slowly through this than I had hoped, but let's see how many more I can get to. Okay, so, this is a great question from Ina. She's seeing an acupuncturist who told her that she should avoid fast carbs like pasta and bread, as she should keep her glucose low and blood sugar stable at all times, and if not, it would increase testosterone. Oh gosh, this is just so steeped in diet culture and everything. I mean, so our bodies actually need glucose and insulin, and this idea that we shouldn't have any or we're going to somehow become diabetic our bodies just don't work like that. So our hypothalamus is actually sensitive to both glucose and insulin. So, and there's sort of a baseline level that it needs in order to be activated. So that's why I actually think the carbs are really important for recovery. When many women lose their periods simply from going on a low carb diet. And I think it's part of it is just that the hypothalamus isn't getting those signals from the glucose and the insulin that spike when you have carbs, like simple carbs like potatoes or white rice or white bread or sugar or any of those things. So I definitely think that working to incorporate some of those things when you're working on recovering is a good thing. Let's see. Emily asked, what if I can't remember my last natural cycle because of birth control? That's actually really common. Many of us go on birth control when we're sort of in our mid to late teens. And so, you don't necessarily remember what your body size was or what your cycles were like. But, you probably had fairly regular cycles if you didn't, if you don't remember them being irregular. And so, you just kind of have to go with the flow and just eat the 2,500 calories a day and let your body decide where it's going to end up. So let's see. Lauren asked, it seems like recovery from HA is similar to recovery from anorexia. Are there any differences between the two? I would say there are a couple of big differences. One is if you're anorexic in a very small body, you often have to eat a lot more in order to fully restore your system and recover, resume all of the functions that your body naturally wants to do. So that's one big difference. And the other is obviously in the mindset. I mean, I think that one of the big differences between somebody who has HA from disordered eating and maybe overexercise versus somebody who has an eating disorder is with just the disordered eating, your mind isn't in it as much. You can sort of learn about HA and recovery and be like, oh, I was underfueling. I didn't know that I had taken my habits too far. Let me fix that. And you go out and you eat more and you exercise less, and that's fine. I think for people with eating disorders, it's so much more difficult to make that initial change and to go all in. It has to be so I really recommend for those women that have eating disorders, working with eating disorder therapists and specialists. Like, that is not something that I'm qualified to deal with. So because there is that whole mental component, and I really think that you probably need a lot of support that people with HA from just disordered eating and not understanding how much fuel our bodies actually need don't need support at the same kind of level. So I think that's probably one of the biggest differences. All right. So in terms of recovery, let's see. Masha asks, I've just recently started the recovery process and I'm feeling a huge onslaught of emotions, negative, positive, and most of all, saddened that I have done this to myself, even though I thought I was being healthy. I think that so she continues, I know the emotions could be hormonal, but this seems even deeper, like a way that I was numbing myself. Restrictive eating and exercise is now shut off and everything is coming to the surface. Did you experience this? I know others in the community have, and could you talk about it a bit? It's actually not something I experienced personally. I think probably because I was not restricting my calories for a very long time. I was lucky in a way that I wanted to get pregnant pretty quickly after I lost weight. I thought I was doing the right thing by losing weight to make it easier to get pregnant. So I went off the pill about a month later, and so I wasn't very deep into HA at that point. So I don't think I experienced some of those emotions, but I know that it is really, really common to feel this way. I think it can be helpful, again, to talk with a therapist. somebody who's trained in sort of helping you work through these emotions and feelings, which I am not. So I think that would probably be my biggest recommendation, is if you're feeling really out of control and overwhelmed by the new things that you're feeling, talking to somebody who can help you kind of work through those would probably be a good idea. Okay, so let's see. Emily asks, is it okay to be on the pill while trying to do all this recovery? I would say probably. I think as long as you realize that being on the pill, the bleed that you're getting is not a real bleed. It's not signifying ovulation or any of the other hormones that go along with our menstrual cycle. So particularly if you have low bone density, you could be on the pill. Hormone replacement therapy, natural estrogen and progesterone is potentially better than the pill. So that's something that you could discuss with your doctor and your maybe if you're seeing an endocrinologist for the bone density, you could discuss with them. So let's see. So Alexandra just made me laugh because she said it seems you have all kinds of therapists in the US. I think we do. So that cracked me up. So let's see. I've already covered the rationale for stopping exercise. Jenna writes, I've reduced exercise, gained weight. LH is still only 0.3. Any ideas? That probably takes digging a little bit deeper into how you're spreading your food out through the day. There might be some other things that you could try. Supplements is one thing, and I think Alexandra had that question. So I don't recommend a lot of supplements for HA recovery, simply because there's not much evidence that they're actually helpful. Some of them, there's evidence that they're actually not helpful, like Vitex, which is something that's often suggested to people by naturopaths or acupuncturists or chiropractors or whomever is suggesting these supplements. Really, the key thing is to be eating more and exercising less, and obviously the ingredient of time. There is a chapter of my book called Still No Period that has a bunch of other ideas for somebody who is kind of still feeling stuck. But in terms of supplements, the two that I do recommend are acetyl L-carnitine, particularly if your LH is less than 3. That's based on 3 studies that have been done in women with HA, which is great and somewhat unusual. And they found in the 3 studies that the recovery rate with taking the acetyl L-carnitine ALC was about 70%. So that is pretty great. And so the ALC seems to work by increasing LH. So if you're in this position where you've made the recovery changes and your LH is still low, that is something that you could consider. I have a blog post on that. It's noperiod.info/ALC. And the other thing that I commonly suggest is ground flaxseed. Blog post on that is noperiod.info/flax. And that one, there seem to be a lot of potential benefits to eating flaxseed. Plus, it can give you some more calories, and there is some evidence that it can be helpful in HA recovery. So that is, that's another thing that I often recommend. The dosage that they used in many of the studies was 10 grams per day, which is about 1.5 to 2 tablespoons. So that's something else that you could try. Let's see. Jessica is asking, how long do you recommend taking ALC once you get your period back? What I typically recommend to people is you just finish out whatever it is that you have left and stop at that point. So you could, you could take it at the same dose for maybe another couple weeks and then divide it in half, take half the dose until you finish the bottle, and then that's it. So I don't think you need to continue taking it because the increase in LH to get your system kickstarted, that's happened. So I don't think you need it anymore. Okay. So I've got a couple of pregnancy and so here's some recovery questions. Laura wanted to know about follicular waves. She says, I seem to be experiencing fortnightly signs of ovulation and then nothing after that. So follicular waves is basically your body is starting to grow a follicle. You might experience egg white cervical mucus and other related changes, but your follicle doesn't quite get big enough to actually ovulate, and so it dies back, and then your body tries again. It can be 2 weeks later, it can be 4 weeks later. It sort of depends on your body. So I would say that typically you might see 2 to 3 follicular waves before you actually get to ovulation and a period. If you've been going for long, if you've had them for longer than that, and you've sort of done all the recovery things in terms of gaining weight and eating more calories and cutting your high intensity exercise, then you could again think about some of the other options that I described in the still no period chapter, which can include the oral medications, soy isoflavones, Clomid, Femara, hypnosis. So I'd love for somebody to try hypnosis. Actually, I know one person who tried it and it worked for her for a little bit. I think that that's something that might be, it seems like something that's kind of fun to try. So Alexandra is asking why flaxseed, because of the omega-3. It's actually the lignans that are in the flaxseed, and those can be helpful. I wrote the blog post a little while ago, and so I don't remember honestly, but it's all in the blog post, so you can check that. All right, recovery. So Ivy asked about eating too much fiber and seeing how fiber can hurt hormone production. I think I have looked into this in the past. I sort of remember not being super convinced by this idea that too much fiber is harmful, but I do think, so a couple things here. So number one, a lot of people, when they are sort of in the clean eating mode of thinking, will eat a ton of vegetables. And what I find when you're working to recover from HA is that can actually make recovery more difficult because the vegetables fill you up a lot without providing a lot of calories. So I often recommend cutting down on the number of vegetables that you're eating. Maybe eating other things in your meal before you have the vegetables and having the vegetables last, just so that you're not filling up on vegetables and then not eating things that actually have more energy and more calories in them. So I guess, the fiber can be less ideal in that sense, just in that if it's part of foods that are high volume, low calorie, that can be problematic. I think I do have a draft blog post started on fiber, so I will go back and finish that one up and publish that hopefully sometime soon. But in general, I wouldn't focus on trying to get in high fiber foods. I would just kind of eat the things that you feel like eating and, focus on really getting the energy in that you need, which tends to be some lower fiber options, like maybe adding salad dressing to your vegetables, or, plenty of other things like all the highly palatable foods like pizza and burgers and French fries. And, those can also be part of part of what you eat on a regular basis, especially while you're working to recover. Okay, a couple of questions about sort of ovulation and periods. So Bentley is asking about what should your basal body temperature be prior to and after ovulation. I would say typically prior to ovulation, it's sort of in the 97 to 97.4 range Fahrenheit. And I think that's about 35.8 to 36.1 Celsius. And then after, you'll see it go up by probably 0.3 to 0.4 degrees Fahrenheit. So maybe to a 97.6 up to 98, and maybe like 36.3 to 36.6-ish in Celsius. Emily asks, is it typical to have very light or short cycles when finally getting cycles back after HA? I think meaning in terms of how the periods are. So yes, I would say especially the first few periods, it's very common to have very light, maybe it's even just spotting, and that typically will get to be more normal for you over time. What's normal for periods actually varies a lot. Some women, 3 days is normal. Some women 7 days is normal. Some women can, fill one super tampon in 12 hours, and some women are changing their tampons every 2 hours. So there's a really wide range in normal, and I think part of it kind of comes from a couple of different factors. One is how thick your lining has gotten just during that cycle. One is how your body gets rid of the lining. Some of the lining is shed through bleeding, and some of it is actually reabsorbed. So the ratio between those two can be different in different people. So that can be, that I think it often takes a few cycles to kind of get to get back to your personal normal. And that can, that can be different when you're older than it was when you were a teenager, because our hypothalamic pituitary ovary axis doesn't mature until we're about 25. So our periods in our 20s and 30s can be quite different from when they were in the teens. Like for me, when I was a teenager, my periods, like I would bleed for a good 10 days, which really sucked. And, now I'm sort of like, I have 3 days of real bleeding and 2 days of spotting. So, that's very different, but that's my normal. And obviously I've been able to get pregnant multiple times. So I don't think that what your particular period looks like necessarily has a lot to do with being able to get pregnant. If you find you get your cycles back and you're not able to get pregnant, then it would be worth maybe going to see your doctor and having them check the thickness of your lining during the middle of your cycle, the middle of your luteal phase, just to see where it's at, and just to see if that, if thin lining is something that's causing a problem with getting pregnant. Okay, so a couple of people asked about second periods and third periods and how long that can take, and do I have any more information than what is on my blog posts. So if you're interested in that one, it's noperiod.info/cycles and noperiod.info/second-cycle are the two blog posts. So it's funny because waiting for the second cycle can sometimes even be harder than waiting for the first one, because now you're like, okay, my body did it once, like where is the next one? So I think that, making sure that you are continuing to eat, eat the 2,500 calories or whatever it was that your body needed, still not doing high intensity exercise. That's really important. After you get your first period, not to incorporate high intensity exercise just yet. You can at some point down the line, but I really recommend waiting 3 cycles before doing that. And you could possibly get blood work checked to see if, where your LH is at. Maybe the acetylcarnitine might help. If you've had your first period, but your second is MIA still. You might also think about where your body size is at. Are you at a place where your body is likely to be happy, or are you still at a suppressed weight? Because often women can get a first period while they're still at a weight that's too low for their body. And they're like, oh, yay, I can stop here and I don't have to gain any more weight. And so they don't, but it's not actually a place where their body is truly happy and healthy. So as far as data, though, I don't have any additional data on that. Okay, a couple things on pregnancy and post-recovery. So in terms of adding exercise post-recovery, like I said, 3 cycles, and that's for a couple of reasons. One, to just allow your body time to equilibrate to the new normal. 2, so that you know what your cycles are like, because when you get to the point of adding back exercise, it's really nice to have a baseline so that you can kind of track your ovulation, track when you're getting a period, and see if the exercise that you're adding is, kind of setting you back. And then maybe you dial it down a little bit more again, or maybe you just stick where you're at for another cycle or 2 to kind of see what, to let your body re-equilibrate again. So in terms of reintroducing exercise, I recommend taking it really, really slowly. I have a recent blog post on this as well. I don't remember the link off the top of my head, but it's really easy to be like, yay, I'm recovered. I've had my 3 cycles. Let me go back to 4 days a week of exercising, and boom, periods go missing again. So I strongly recommend taking it slowly. Maybe adding back 10 minutes twice a week to start with for that first cycle. See what happens. See how your ovulation, see if your ovulation is impacted, see if your luteal phase is impacted. And if not, then great, you can go and double that for the next cycle. So just know that you can get back to a higher level of exercise over time, but just that you kind of still need to pamper your body for a while before you can get to that level. Diamond Body PT asked about losing weight without losing periods once recovered. I would strongly recommend against actively trying to lose weight, because the way you do that is by cutting your calories, and that's just going to send your system right back into shock again. Once you've had the 3 periods, you can start really thinking about eating more intuitively. Eating when you're hungry, although I always recommend eating in the morning, like when you get up, having breakfast, certainly before any exercise. I think that's really important, because our bodies need fuel throughout the day. And there's another blog post I have, noperiod.info/energy-balance, that talks about this. And there was a group in Sweden that did a study and found that among 2 groups of women who were both ostensibly eating the same amount, 3,500 calories a day, and exercising the same amount, about 1,000 calories a day, one group had their periods and one group didn't. And the group without their periods was in an energy deficit for 4 hours longer per day. So I think really important to be fueling throughout the day. I think just not focusing on your body and your body size, just let your body kind of do what it wants to, and appreciating it for all the amazing things that it does, like we talked about earlier. And you might lose weight over time when you're just not focusing on what you're eating and not focusing on your body. But I think that you're likely to get into trouble again if you are actively trying to lose weight. So I don't recommend that. I would love for you to learn to, if not appreciate and love your body, at least be neutral about it. Like, this is my body, it is what it is, and I can do all these cool things. And so I don't care, if it might be slightly larger or a lot larger than what society tells us is quote unquote okay. Because I think for so many of us, trying to follow those societal ideals of what is okay, it's just led us to a really bad place and a really unhealthy place. So I think kind of letting go of those ideals can just, it just makes for a much happier life, because you don't worry about that. You don't worry about what other people think of your body or your body size. It's like, I'm just living in my body and it does all the things I want to do. It lets me play with my kids. I get to play ice hockey, which is the most fun sport ever. That would be my recommendation. All right, folks, I'm sorry if I didn't get to your questions. I actually have to go because I'm meeting with a client in 1 minute. So I hope this has been helpful. And again, I do work with women one-on-one, and it can be really helpful because we can go through your history and, your specific questions, your concerns. And obviously, if you don't have my book already, then it's a great resource. It's got 500 something pages of information, and so that is it, and I will chat with you soon. Bye.